The prostate is a small gland located deep within the male pelvis. It sits just below the bladder and surrounds the upper portion of the urethra. Behind it lies the rectum, and above it is the base of the bladder. Although small in size, the prostate plays an important role in male reproductive health. The prostate encircles the urethra like a ring. This position makes it unique. Any change in its size or structure can directly affect the flow of urine passing from the bladder through the urethra. In its normal state, the prostate has a smooth outer capsule and a soft, uniform internal glandular texture. The urethra passes through its center, allowing urine to travel freely when the gland is healthy. The prostate is divided into zones. The peripheral zone forms the outer back portion of the gland. The transition zone surrounds the urethra. The central zone lies deeper within. Most prostate cancers begin in the peripheral zone, while enlargement commonly begins in the transition zone. Urine flows from the bladder into the urethra and passes directly through the middle of the prostate. When the gland is normal in size, this passage remains open and unobstructed. Inside the prostate are small glandular structures that produce prostatic fluid. This fluid becomes part of semen and helps nourish and transport sperm cells. The production of this fluid is regulated by hormones. Testosterone, produced primarily in the testes, is converted into a more active form called dihydrotestosterone, or DHT. This hormone strongly influences prostate cell growth and maintenance throughout life. As men age, the prostate may gradually increase in size. This enlargement is common and not always cancerous. However, because the urethra runs through the gland, enlargement can narrow the urinary passage. Benign prostatic hyperplasia, or BPH, occurs when the prostate grows larger due to non-cancerous cell overgrowth. The enlarged tissue compresses the urethra, reducing the diameter of the urinary channel. As the urethra becomes compressed, urine flow weakens. Men may notice difficulty starting urination, a reduced stream or incomplete bladder emptying. Inflammation of the prostate, known as prostatitis, can cause swelling and tenderness. The gland may appear enlarged and irritated, sometimes accompanied by discomfort or urinary symptoms. Prostate cancer typically begins when a single cell in the gland develops genetic damage. Most early cancers arise in the peripheral zone. At this stage, the abnormal cells remain small and localized. As cancer cells multiply, they can form a small tumor within the gland. In the early stages, this tumor may not affect urine flow because it develops away from the urethra. If the tumor grows larger, it may eventually extend toward the capsule surrounding the prostate. Breaking through this capsule increases the risk of spread beyond the gland. Cancer cells can enter nearby blood vessels or lymphatic channels. Once inside these pathways, they gain the potential to travel to distant areas of the body. In many cases, early prostate cancer produces no noticeable symptoms. The gland may appear normal from the outside while microscopic changes are occurring internally. The prostate releases a protein into the bloodstream called prostate-specific antigen, or PSA. Elevated PSA levels may signal abnormal activity within the gland, including enlargement, inflammation, or cancer. From an anatomical perspective, the prostate lies directly in front of the rectum. This positioning allows physicians to assess the posterior surface of the gland through examination. If abnormalities are suspected, a biopsy may be performed. A thin needle is used to collect small tissue samples from the prostate for microscopic evaluation. When comparing a healthy prostate to one affected by cancer, differences become clear. A healthy gland shows smooth structure and uniform tissue. A cancerous gland may contain irregular masses, distortion, or compression of the urethra. Although prostate conditions are common, early detection significantly improves outcomes. Understanding how the gland functions and how abnormalities develop helps guide timely evaluation and treatment. If you found this explanation helpful, consider subscribing for more in-depth medical animations and evidence-based health education. Leave your questions in the comments, and share this video to help others understand their health from the inside.